I'm Sophie.
And I'm Brooke, and we're here at OT Connection filling in for Lulu and Kelly.
Today we're going to be learning about urinary incontinence. And the therapist we're going to phone in is a physical therapist by the name of Marina Sperling. Okay, ready? We're going to phone her in right now. What can you tell me about urinary incontinence?
What would you like to know? I mean, it's a pretty big subject. Urinary incontinence can have many causes. Some of them could be because of increased pressure in the bladder, which and when the pressure in the bladder gets too severe, with even a drop of urine that goes into the bladder, it causes that pressure to be higher than the one in the urethra, and therefore expelling the urine and causing incontinence.
And what kind of factors would cause all this pressure?
What kind of factors?
Yeah.
There could be fascial restrictions, like ligaments that attach the bladder. There's some ligaments that attach the bladder to the bones in the front, and then they cross through to the uterus, rectum, and ultimately connected to the sacrum. So if there's any tension in any of those structures, whether it be skeletal, like the bone, or whether it be some issue with the bowel, or maybe some female issues, it can cause problems with the pressure. That's why so many people, after they give birth, have problems with incontinence.
Oh, okay. Well, for treatment, since you're a physical therapist, what kind of treatment do you usually do with your clients who complain about urinary incontinence?
Well, there's a bunch of treatments. The first thing is I will manually work on the ligaments and the fascia to reduce tension that's coming from other structures, both that's coming superiorly. You can work on the ureters that come from the kidneys to decrease that tension. You also will work on the pelvic floor. You want to strengthen the pelvic floor. You want to strengthen the pore strength, which is usually the transverse abdominis, the diaphragm, and the occiput in addition to the pelvic floor. So that way you can increase the control, the conscious control the patient has. Let's see, and then there are some types of electrical stim that patients can use to try to regain control as well. And you can also give the patients a chart where they will go to the bathroom automatically, say, every 2 hours, and thereby making sure there's not too much urine in the bladder that can expel.
I was reading about people using diaries to record how much they drink and how much they go. Do you see any patients who have done that, and do you think it's worth the while?
Diaries are very, very important. That's one of the things we actually ask the patients to do right away, so that way we can see how much they're drinking, how much is coming out, and what's going on during the day. For instance, whether or not their incontinence is worse during the day or whether it's worse at night, depending on the position they're in. Also, it's been noted that if people think that if they don't drink, then they won't have to go to the bathroom, but actually studies have been found that the less you drink, if you become more and more dehydrated, it actually causes the incontinence to get worse. So there's a lot of education that comes along with treating incontinence.
Oh, okay. That's interesting. And we also read about slings, how they use different types of vaginal slings as a surgery procedure. Do you
We hate slings. Slings cause scar tissues, slings cause pain, slings cause problems with intimacy.
Oh my gosh.
There's plenty of commercials that you will see about attorneys going, if you have a mesh or a sling, please give us a call because you will blah, 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 blah. Slings are not my favorite.
Okay, I got that much. There has been, I guess, a 70% success rate with slings, but there's also been a 90% success rate with very mild stress urinary incontinence if you practice the Kegel exercises. Can you explain what those are?
The Kegel exercises is the pulling in of the vagina and the wall, so that way you are strengthening the pelvic floor. Because the bladder sits directly in there, which changes the pressure dynamic in the bladder. You increase the pressure down in the urethra, and it gets higher than the pressure in the bladder, thereby decreasing that equal point and making the bladder more functional, more efficient. Also, it increases the strength of the entire pelvic floor, pulling things up a little bit and increasing the tensile strength down below.
Okay.
Pretty much what we tell the patients is they're going to squeeze below and lift up like an elevator towards their belly button, try going up to the 10th floor and very slowly coming down. There's multiple ways of doing the cable. But a proper core exercise program will include cables.
Oh.
So people that do not have incontinence issues, their core is a big deal these days and everybody's talking about it. You know, if you're doing core stabilization and strengthening in the proper way, you will do kegels as well.
Okay. And is urinary incontinence something you mostly see in women after they have children, or do you see it ever in men?
Oh yeah, urinary incontinence can be in both women and men. It's more often in women than it is men. But it can happen to both sexes. And yes, urinary incontinence happens a lot with age with women, but especially after pregnancy, a lot of women tend to have some leakage, or especially with intrathoracic pressures, like sneezing or things of that nature.
And does that increase with age? Usually once...
Urinary incontinence usually increases in age because you decrease tensile strength usually, you know, ligament strength kind of goes down with age. That's just natural things, processing that happen. So things get a little bit saggy, get a little bit less controlled. And when you have less control, that's when you can put things in an inefficient pattern or position. And that's when urinary incontinence is usually found.
Do people usually feel embarrassed or ashamed when they come for this treatment? Have you noticed any of that, or do people just come and complain?
By the time people come in for a treatment, they're usually not ashamed or hopeful because they don't realize that physical therapy is a viable option for this, and they've been living with it for such a long time. They're more living with, fear and shame of having accidents. So they're very hopeful and excited about trying something that possibly can help their problem and getting them out of the fear and shame.
Okay, wow. That's pretty good. Thank you.
You're welcome. Does that work?
That works.
Okay.
How do OTs and PTs work together with patients who have incontinence?
I have no idea what OTs do for patients.
Okay, well, OTs in general help patients do their pretty much daily activities and fun activities. So if one of your patients was complaining of having incontinence every time they went running, and they love running, what could you possibly tell an OT of how to help them with that?
I honestly don't know what it was. I know you said activities of daily living.
Yeah.
So I guess an OT would be there to try to help the patient with protection in the sense of, what they should be wearing, to make sure that when they have accidents, they don't have any leakage.
Oh. So PTs don't deal with the sanitary napkins and all those guards that are meant to help keep the patients dry.
We do deal with that, but there's occasionally the patients that need help with the how to physically put on the sanitary napkin. Maybe they have issues with their hands or weakness or whatever. PTs deal with education, maybe OTs deal with figuring out ways to make the patient more independent in ability to change napkins and things of that nature.
Oh, okay.
I'm guessing here, so.
Okay. That sounds pretty good. I've seen different therapies like that. Okay. Thank you.
You're welcome.
Types of incontinence are stress, urge, and overflow. Stress incontinence is when there are small amounts of involuntary bladder leakage. The amount can range from just a few drops to dribbling and is most common in women. This leakage usually occurs with a laugh, cough, sneeze, or some kind of exertion like lifting or exercising. Urge incontinence happens when the bladder muscles squeeze too often, or when you don't want it to. A person dealing with urge incontinence knows they need to go and usually has frequent, strong, and sudden urges to go, but cannot always make it to the bathroom in time. This is a very common type of incontinence and is sometimes referred to as an overactive bladder and occurs twice as frequently in women as in men. Sometimes someone dealing with urge incontinence will also be stress incontinent. Overflow incontinence is when urine overflows and leaks out of the bladder once the bladder has reached certain fullness. Overflow is often accompanied by dribbling, and the frequency and urgency that one urinates increases. Overflow incontinence can be caused by an obstruction, a diseased bladder, an enlarged prostate, or a fecal impaction.
So, in addition to your endurance and your power exercises, it's important to incorporate some pelvic floor tightening through your active day. For instance, before coughing or sneezing, tighten the pelvic floor, and that will protect the pelvic floor and prevent leaking whilst coughing and sneezing. So also, while exercising, try and engage the pelvic floor gently at about a third of your full effort, and this will help protect your pelvis, your back, and prevent leaking.